Hello and welcome. This is Dr. Keley John Booth. I am a spine and joint specialist here at Orthobiogen in Oklahoma City, and we are Oklahoma's exclusive Regenexx providers, treating peripheral spine and joint conditions, whether you suffer from back pain, degenerative disc disease, knee arthritis, rotator cuff injuries, and other orthopedic conditions. We specialize in non-surgical treatment for orthopedic conditions of all types, and Regenexx is America's most trusted name in regenerative medicine and interventional orthopedics. And thank you for joining us this evening. So I wanted to kind of transition here into the talk and kind of give you essentially an idea about what we're going to be going through. This is essentially an introduction to why you may want to consider Regenexx as a treatment alternative. And there will be an extensive ability to ask questions and kind of go through things. And so I'm really going to let you guide me and the attendees guide me through what you want to talk about here later after we get through the presentation component to give you a little bit of the lay of the land, and hopefully I generate some new questions, maybe things that you hadn't yet considered or as you were contemplating treatment. All right, well, with that, we're going to go ahead and jump into it here, okay? All right, so we're going to go ahead and go over here. All right, so could Regenexx be the answer to your pain? That is something that probably many of you are asking, or you wouldn't be with us tonight. So I'm hoping to again, answer those questions. So, all right, so many of us day to day in our active lifestyles are having and suffering from knee pain, whether you're in the midst of a workout, maybe you're doing work, maybe chasing after the kids. You're trying to find out, what's going on, trying to get some answers. Unfortunately, healthcare today is really failing us because it doesn't often get us the answers that we're looking for about what exactly is wrong. And we're really fortunate, and this goes for me too. If I go to see a clinician, very often they don't spend more than 5 or 10 minutes with me. And that's where we make a big distinction between, we really have gotten away from listening to the patient, really doing examinations of the type that would be helpful to really help us figure out what is really going on with patients. Other areas, back pain. You can really slow your day down. Essentially, it's estimated that 80 to 90% of people at some point in their lifetime will suffer a back problem of some type. Fortunately, the overwhelming majority of those do not require surgery. And a lot of people don't realize that about 90 to 95% of all the spine surgeries performed in the United States are really done on an elective basis. I know it doesn't feel that way when we talk to our surgeons, but very often this is an elective optional thing. And you really have to think long and hard about what your goals are and kind of have some realistic expectations. We'll talk more about that. Again, running is a common one that we see, meniscus tears. I have a colleague, one of the founders of Regenexx, actually, Dr. Centeno. He talks about meniscus tears being as common as wrinkles. We are all going to get them eventually. And unfortunately, Botox does not work on meniscus tears. So that's one issue there. So, all right. So talking more about Regenexx, why Regenexx? Regenexx is really unquestionably, and I did a lot of research before I decided to become a Regenexx physician, and really wanted to figure out who is the leader in this field, who is the organization, who are the physicians that actually have the skill set necessary to really change musculoskeletal healthcare in a way that I think is truly unique. And that's where I found Regenexx really sets itself apart. Many people don't realize that, what does it take to become a regenerative physician, a so-called regenerative physician? Well, you can watch a couple of YouTube videos and order a centrifuge off of Amazon. And on Monday morning, congratulations, a regenerative physician. I can tell you that exactly 0 Regenexx physicians have that experience. In my case, I trained for over 2 years before I ever performed my first Regenexx procedure. So I've actually been working actively with Regenexx since 2017 and started performing procedures in 2019. And so it's just to give you an idea. And I was already a board certified physician, been doing procedures for 20 years. And so just to give you an idea of what that entails. All right. So, and now we get to, well, what's Orthobiogen's role? Well, we are the practice that essentially brings Regenexx to Oklahoma. So we are, by virtue of the training experience that we have, we are the leaders in regenerative care in the state of Oklahoma. Nobody does more complex regenerative care than we do. And we have the most advanced techniques treating orthobiologic procedures, in the state of Oklahoma. So we'll talk more about those things later. So, so let's get back to traditional orthopedics and kind of what the options are. And a lot of this you've seen before, but I really wanted to kind of put a fine focus on these points of what's the traditional approach. And unfortunately, a lot of my colleagues, when I talk to them in confidence, orthopedic surgeons, I have a lot of good friends that are surgeons. They're very limited in what they can do because they say, well, Dr. Booth, what do you want me to do? Because insurance is only going to allow me to do certain things. Unfortunately, that's the reality of where we're at in healthcare today. So they're not coming into the room telling you all the options that you have because insurance isn't going to cover them all. At least from their viewpoint. And then it's an entirely different problem. Do they actually have the training and skill set to actually deploy all the options that may be non-surgical? And we look at this picture, which admittedly is kind of scary, right? When we look at that and we say, wow, that's what I have to look forward to when I go to surgery. And for a clinician, especially in a surgical specialty, this is kind of day-to-day life for us. There's nothing in here that kind of is unusual or uncomfortable or graphic or otherwise. But as a patient, right, when you're the one on the other end of the treatment, you're looking at it from a different side. And boy, you really think, well, gosh, is there an option? I'd like to know about it. Even if it's something that maybe the surgeon doesn't do, but maybe I'd like to talk to someone about it. And that's why we're here. So traditional orthopedics, again, kind of a one-way street. And I will tell you, if you have knee pain, if you have knee osteoarthritis or degenerative disease, meniscus tears, those types of problems, you're going to end up on this pathway one way or another. This is the classical pathway to virtually every knee problem that we see, unless you're a high-level athlete and you've taken out your ACL. Some of you may have seen that there was a game over the weekend where a player had a fracture. Totally different deal. In the traditional orthopedics, blind joint injection is really what is being done, every day across the United States by the tens of thousands, millions a year. And so this rapidly goes on to the knee scope, which rapidly goes on to joint resection. And some people, they just skip you ahead to the end and they say, well, you'll meet the qualifications for it because insurance will let us go ahead and do that joint replacement. So what are the problems with blind steroid injections? Well, one of the big things that we know about a steroid inside of a joint, when I make a distinction there, because, we use steroids in our practice, and we're really looking at doing a situation where, the joint is a different animal compared to, say, an intramuscular injection. That is a challenge for you, because it can change the way the cells inside that joint function. And this is a study that was published in in JAMA, which a lot of you have probably heard of before, the Journal of the American Medical Association, which is one of the most esteemed medical journals in the world. And they published this article in 2017 that showed that doing a blind steroid injection for as little as 2 years, repeat injections separated by 3 months, that's not an aggressive track. Every 3 months, that's actually a pretty conservative approach. There are people that do it much more frequently than that. And despite them doing it only every 3 months, they were able to measure the amount of cartilage loss in the knee in that time frame by taking an MRI at the end of the study. Now think about that. they're actually able to measure. When you can see a difference in the cartilage, that is pretty significant. And so this was really shined a light on things. And of course, there were other things that showed us that we had evidence of this type of a problem going on, but this is one of the better studies that was done in this area. And so, first of all, blind steroid injections, we just don't do them. And we certainly don't do them every 3 months for 2 years because we know what it leads to. Okay. So next, knee arthroscopy. Okay. And meniscectomy. That's a word. So that the surgeons use to describe actually going in and putting essentially a scope in your knee and taking out some of the tissue. Okay. Now here's what's interesting about this. I would say on average, about 9 out of 10 patients that come in to see me, and they'll say, well, Dr. Booth, I had knee surgery, but it's okay. It was a knee scope and they repaired my meniscus. Well, I usually kind of scratch my head and I say, well, now what type of repair and what was the nature of when they did that surgery? And almost inevitably, we get that report back from the surgeon's office, and there was no repair. They actually cut a portion of the meniscus out. And patients are surprised to find that out. They thought that they were going in for a repair of the meniscus. If you're over the age of 35 years old and you go in for a knee scope and you have even a relatively low level of osteoarthritis, they are going to probably shave your meniscus. I can tell you, I used to run a surgical department from the anesthesiology side. And I tell patients I could count on one hand the number of times I ever saw a knee scope where they didn't take some tissue. And because, from the hospital perspective, they don't want the orthopedic surgeon to operate unless they're going to do something, because typically that doubles the amount of reimbursement for them, because basically they've warranted that, because now they're taking tissue. If they just go in and they put a scope in and they look around, that doesn't actually generate much in the way of billing. So, you take a little bit of tissue, and some surgeons are more aggressive than others and they take more tissue. And so, as you can see here, this was in the also a very esteemed medical journal, the British Medical Journal. We have known for 20 years that doing that surgery with a knee scope and going in and essentially taking out a little bit of the meniscus is no better than doing a fake surgery. And you didn't mishear me there. I want to make sure that everyone understands that. A sham surgery is what we call that. And what they did is they actually said, okay, we have patients, let's say we have 100 patients, and they get randomized to different groups. One group, and no one knows what they're getting because they get incisions as if they had the surgery, but all they did is make the incisions and then send the patient home. The other patients that got randomized to the other group got incisions, had the meniscectomy, the procedure that the surgeon wanted to do, and then they sent them home. They went and looked at these patients and had essentially blinded the reviewer, the surgeon that's reviewing them, and they basically found that there was no difference in the outcome. And what's shocking about that is that this is still one of the most common surgeries performed in the United States every year. We do hundreds of thousands of them in America. And there are orthopedic surgeons and actually organizations that are lobbying against trying to disallow these procedures to be performed, because we've known for 20 years that essentially it's no better. And there is risk. There's risk from anesthesia, there's risk from infection, there's all these other things. And if you know that we can't prove that it's any better than just poking a hole in your knee, you're probably safer just poking a hole in your knee and going down the road. So pretty shocking, but true. And don't believe me, look at the published research. All right, so what happens when you take a blind steroid injection and you mix that with a knee scope and you shave out the meniscus, which has been shown to actually increase the damage within the knee, decrease cartilage, and ultimately increase your chances of getting a total knee replacement. Well, it's not very hard to figure out where this leads. One of my favorite, I'm being facetious, least favorite things is, this concept of bone on bone. I have at least a patient today, typically several, sometimes as many as a half a dozen come in and tell me in a single day, and they all say the same thing. I've been told to have bone on bone. I don't have any cartilage left. And so I like to make bets with them and say, what do you want to bet I can show you some cartilage today in your knee? And I win virtually every time, because almost no one would make it to the point of having true bone on bone, no cartilage, right? That is, and allowing someone to believe that they have no cartilage left, I think is a little problematic, right? Because it just doesn't quite work that way. But this is where we get bone on bone. And because I've pumped a bunch of steroid in there over a period of, let's say, 2 years or longer, that cartilage is going to get damaged. I know that, and the research shows that clearly. And then if I go in and take out the meniscus, I know that I'm missing the padding between the bones, which is going to cause them to wear down faster. And there you go with the advancement of the osteoarthritis. And ultimately, there's no treatment left. The unfortunate thing is that's kind of where all roads are leading for orthopedics anyway. It's to this definitive state of, okay, well, we couldn't save it, so we're going to go ahead and cut it out. And I don't want to be too cynical, but take a wild guess which one they get paid the most for. In America, it's estimated that the cost, depending on where you're located and what facility does the procedure, your knee replacement can cost $30,000 to $50,000, and it can be higher depending on the complexity and the type of implants that they use. And so, just to let you know what's going on, and insurance pays you, on the order of $100 for a steroid injection, a blind steroid injection. So $100 versus $30,000 to $50,000, you kind of start to realize how sometimes, boy, I don't know, how hard and how well am I going to do an injection when ultimately I know that I'm going to be going to a knee replacement anyway. And that's one of the challenges we have in the field. So a couple of other statistics that I think are super valuable to understand, and I don't think they're ever quite put this specifically for patients. 1 in 3 rate of dissatisfaction with surgery. This is when you ask the patients how they did post-surgically. So how do you feel and how happy are you with your knee replacement? Literally 1 in 3 are dissatisfied. So boy, that's tough. That's kind of okay. Makes you scratch your head. Another one is 1 in 5 rate of chronic pain after surgery. And again, this is all from published data that's out there. And I had 3 patients in my office today that all have chronic pain after having a knee joint replacement, and every one of them is looking for an alternative because they're worried to undergo surgery again, or they want to delay it as long as possible because they don't want to have pain in their other knee the way they do in the one that's been replaced. And again, this is independent of how it functions. It can function perfectly well. It can move well. It can look great on x-ray, but it can still cause pain, unfortunately. And a 1 in 5 rate of complication and a 1 in 20 rate of serious complication. When we talk serious complications, this can be something along the lines of dealing with blood clots, other things. When you get into infection, the rate is 1 in 100. So 1 in 100, and just to give you an idea, there are multiple surgeons in the state of Oklahoma that do more than 100 a year. So if they do 100 a year, the estimate is on average, they'll have about 1 infection per 100. So multiple infections in a single year. And if you're that one, boy, it's tough. And, it creates a lot of issues. Sometimes you have to have an entirely new surgery, sometimes multiple surgeries to wash the joint out. And sometimes they have to take the hardware out and completely replace it. And that can obviously present issues. And then, your 90-day mortality rate is between 1 in 200 and 1 in 400, depending on what resources you look at. But it's been rated at that high. So that's that's significant. So I think it's worth pointing out there, just in fairness to the surgical world, is that on average, the age of people that get knee joint replacements are going to be in that 65 to 70-year-old range. So that impacts that number a little bit, but still pretty significant. But all the more reason to consider, a potential alternative before you undergo what'll be probably the largest surgery you ever have in your life. All right, so spine surgery outcomes. I wanted to kind of give you a couple of things there. So as many as 2 out of 5, or 40%, have pain after spine surgery. We had a really terrible case where a doctor was actually attacked by a former patient that had had spine surgery because he was very angry and ultimately took the life of the surgeon. This is a terrible thing, and I think many of us saw this. If you're from Oklahoma, on the news, it was actually a national news story. And so you think about what a terrible thing, but think about how many people must have been out there, still having pain. And I think sometimes setting those expectations is important when you go through surgery. And I'm not here to say that no one needs surgery, but you really have to contemplate, what are your expectations? And I always tell patients, look, surgery for spine pain is a different proposition from surgery for weakness. If you're having weakness, if you're losing strength in the legs, those types of things, that's a problem that needs to be addressed. And sometimes you do need to make more room in the spine to allow that nerve to breathe and get the blood flow that it needs. So, but if you're suffering from pain, you may want to exhaust all other options, because, you got a 40% chance of having continued pain after. And then you see the next graphic there, nearly 1 in 5 will require a second surgery due to complications later. And that particular study said that could happen in as little as 3 to 5 years. And that's typically what we see. We see patients commonly have a surgery, and then at some point within a number of years, we'll have a second. And it's not uncommon to see even a third and a fourth. I had a patient in my office today that had 5 cervical spine surgeries. And so, has been told that there's no other surgical options. And unfortunately, she has still rather severe pain that she would describe as worse than before she ever had surgery. And so just wasn't ever able to get relief, unfortunately, and now has the side effects and the limited range of motion. And so that's a challenge. And she didn't really get to explore all those options in advance. And so that's what we're here to do, is try to help you get options. One point I want to show you too is, from a practical aspect, these images are MRIs that are showing a spine. Here on the top, this is a patient that is not had spine surgery, but still has significant back pain. And you can actually see, if you look closely here, there's a herniated disc that's bulging out the back. At that level, this little line gives you an idea. These are muscles called the multifidi muscles. And this little circular area here that you can see is a muscle. This is a very well-developed muscle. And this muscle is critical for stabilizing our spine. Now, what happens when you have spine surgery? We know that it causes destabilization and harm and damage to those muscles, because you have to cut through them to get to the area that you're actually going to operate. Now, the picture below here is a patient that has had spine surgery, okay? And so as we look at this is literally the same level of this patient as you saw on the one above. And I'd like to draw your attention here to this dark muscle. And if you look down here, you can see this really much smaller muscle, and you can see that it has what we call fatty infiltration and is essentially turned white. Well, the challenge with that is that muscle is essentially dead. It's not going to contract really at all, because it has been denervated from the damage caused by the surgery at the levels above. And that's how dramatic it can be. And I like, to point that out and say, look, this is black and white. This is what we expect. And by the way, this white area is not a surprise. When we talk to our surgical colleagues about that issue, they say, yeah, that's just part of the surgery. But interestingly enough, the radiologist didn't even comment on this muscle at all, although it's the primary stabilizer for your low back. And this is one of the reasons that we see patients have failed back surgery. And there's actually a thing called failed back surgery syndrome. And so really, you know, what we're here to do is talk about, you know, rethink surgery. It's not an easy answer. It's not a fix, and it's not a true replacement. It is an option that you have, but you want to choose wisely and consider what your alternatives may be. Okay. So getting back to then Regenexx and what do we have to offer with Regenexx, you know, again, talking about the 17 years of our network, extensive history. We use your own body's tissue. We have currently over 600 employers provide Regenexx as a benefit. We are the only regenerative network in the United States that has anything even remotely like that at all. And so we have Aetna, Blue Cross, multiple other payers out there that have added that for a specific employer program. Now, I want to make a clarification. This benefit is added by the employer for the benefit of their employees to, one, try to help curb surgical costs, but also to try to help patients make better decisions about what they do, and hopefully to reduce the amount of days of disability and help them do better. And so employers are adopting this in really on a record pace to try to provide that. So, and we do have some employers here in Oklahoma that cover that for their employees. So we also have a flexible lab platform. That's something that we'll show a picture of here in a minute. So, all right. So the most trusted alternative to orthopedic surgery, you know, Regenexx providers, the founders of Regenexx, were the first physicians in North America to actually use a quote unquote stem cell treatment for the spine. And so that was done back in 2005, and they were really pioneers in this area. So that's the level and the depth of experience that our network has. And you know, the research that has been published, it's been estimated that Regenexx has published, when you count the number of patients that are included in the studies published by Regenexx physicians, that it may be as high as 40 to 50% of the research published out there. So we're not just out here, you know, doing procedures. We're actually engaged in research that's moving the field forward. All right. So, and just to get an idea of how many procedures have been performed by the Regenexx network, I ran a number, and I think a lot of us Oklahomans will relate to this. If you took all the procedures that were performed on patients and said, okay, let's gather all these patients and put them somewhere, we'll have a meeting, we would actually need the Oklahoma State football stadium and the Oklahoma Sooners football stadium combined to be able to hold all the people that have had procedures from Regenexx, just to put that in perspective. So, you know, we're talking about 60,000 in the OSU stadium, and you're talking about over 80,000 in the Oklahoma Sooners stadium. So pretty impressive when you think about the numbers and the depth of experience. There is simply no other network that can really speak to numbers like that, and the safety profile and the advanced nature of what we do is just really in a class by itself. All right, so then we get to Orthobiogen and how we, as a Regenexx affiliate, are able to meet the needs of patients and really push the ball forward. Oklahoma's exclusive provider of Regenexx, you know, we really are specialized in our high resolution ultrasound procedure guidance. We also use precision digital fluoroscopic X-ray systems. I always tell patients, look, I don't do blind injections. I gave that up a long time ago. Everything we do is guided because when you come to see us, we want you to know that you're getting the absolute best science, you're getting the best quality, and we absolutely want to deliver that to you at every level. So our new facility, some of you may have not had a chance to be aware that we actually redesigned our facility and built out an entirely new, from the ground up, facility in North Oklahoma City in the Chisholm Creek area. So we're here on the third floor of our medical building at the Memorial Springs building. And we have a almost 8,000 square foot state-of-the-art interventional clinic where I'm broadcasting from today. And you can actually see that there in the picture. All right. So, and again, we are Oklahoma's exclusive provider of Regenexx. We also have satellite clinics in Broken Arrow to help our Tulsa patients as well. And so, all right. So then here you can see this advanced tissue preparation lab. We're going to basically here do our preparation for the bone marrow, for your blood and your platelets. And this is a totally unique facility. There is no facility like this in the state of Oklahoma. We have absolutely designed that to be a very special environment that we keep as sterile as possible. It's tested routinely. We have an independent third-party lab that helps make sure that we keep that environment very sterile. And we have protocols that we follow routinely. I tell patients that, this is the cleanest place probably in the state of Oklahoma. At least that's our goal. And so it is a really unique environment. And we built that with the glass walls because a lot of people really wondered about what was going on in there. And like, hey, how do you do that? And what do you do with my tissue once you take the bone marrow or you take the blood, and how does that get processed? And you can see there that we have the biosafety cabinet and our equipment here on the back counter. And so it gives you an opportunity to see that in action. So love to show that to you and kind of get you an idea of what that's all about. For those of you at your new patient evaluation, we really love giving you kind of a tour of, obviously you can't go inside, but that's why we have the glass walls. All right. The other thing we do here is a concierge care. And this concept comes from really getting back to the roots of medicine and how we used to figure out what is going on with a patient. And that all starts with sitting down and having a conversation with your doctor. So 100% of the time, I come into the room and I sit down and I talk with you. I really want to know, what are you feeling? What your pain levels are? What are you experiencing? Where did it all start? And we'll actually pull up your imaging and we'll go over that picture by picture, line by line, to help you understand what is happening. And if we need to augment that with new images, if we need to do new studies, sometimes we'll do that on the spot. We actually have the ability to bring our high frequency ultrasound systems in to actually do that while you're in the room. Just earlier today, I was scanning a patient's shoulder and able to show them how their rotator cuff was damaged. And so that's actually one of our exam rooms, exam suites, we call them. So this is a state-of-the-art facility here, where this is actually one of two of our twin procedure rooms. And this room is state-of-the-art. You see the fluoroscopy system here. We have the bed that has a 4-way positioning. We have high-frequency ultrasound. We have our digital monitors, all the things that we would need, including emergency equipment. We're able to do full anesthesia in here with an anesthesia provider. And so we actually multiple days a week have anesthesia providers here in the facility performing procedures with us to make sure that we have the absolute best experience. And we're really known for that. Even across the Regenexx network, we are regarded as one of the most highly experienced groups in terms of just providing comfort and anesthesia to our patients. And so, and patients have really given us a lot of good feedback. And kind of secretly, we have had a few patients that have had procedures at other facilities, and they all say, yeah, I'm definitely going to come back here, because the experience is just a lot different when you have really high quality anesthesia and you don't have to worry about the anxiety or the discomfort of having something done. All right, so we talk about also the board certified physician subspecialist, and primarily that is going to be me. I'm a board certified anesthesiologist, 20 years as a physician here in Oklahoma and in Texas. So just to give you an idea, how long have I been doing treatment, for example, guided procedures? I was actually talking with a colleague the other day, And he said, wow, how long have you been doing these procedures? And I said, wow, I thought about it, and my first ultrasound guided procedure that I performed was 20 years ago at the Baptist Integris Medical Center when I was in my residency training program. And we were doing, procedures all the way back then. I will tell you that I could only dream of the technology that I currently have today. At that point, it would just not even seemed possible. But, there aren't a lot of doctors that have been doing guided procedures, with ultrasound for 20 years. And we feel like we've really taken that to the next level here at Orthobiogen. All right, so now we're getting around to the part that I'm really looking forward to, and hopefully you've been saving up your questions, taking notes, and ready to ask. And this is the exterior of our building for those of you that don't recognize it. And so that way you'll recognize it when you pull up, and we're up here in the 3rd floor now. So all along here, that's us up there, and really excited about meeting those of you that I haven't met, and excited those of you that I have met and that I've worked with before. Always excited to talk with you and see what we can do to help you. So next, let's see. We're going to go ahead and shift over here. All right. So on our, and sorry, I have some help here trying to get to the questions. And so let's see here. And go ahead and read one out for me.
So Tammy Williams said, not a question, but just wanted to say how thankful she is for you and your practice making her life better.
Oh, that's awesome. Well, thank you, Tammy. She's one of our, she's been working with us for a number of years now. And we did her treatment. I remember that's been some time ago. Let's see here. I'm trying to switch back over to my, let's see, I'm having a slight technical issue. So give me a moment here. PMP video, there we go. So Amanda, help me with my questions so that I can actually read them.
Yes.
All right, so the next question that I have there is, what is the cost of the procedures? And that's a common one that we get. That's a tough one because there's a huge range of cost. So when we look at this from the standpoint of, we always compare that with the comparative thing that we're avoiding, which is surgery. And I can tell you that there's really no instance where we don't save money over surgery. But if it's not covered under insurance, we understand that is obviously a concern. Our price ranges for some of the straightforward joint injections and treatments that we do, such as PRP, knee treatments, go down as low as $1,000. And some of our more advanced procedures that we do, in particular spine or bone marrow procedures, those can be a higher cost. And so, and that's because of the advanced treatment, the processing that has to occur relative to your tissue and your bone marrow. And so we typically, those may exceed $10,000 depending on what's going on. But your alternative procedure would be something along the lines of a, $50,000, $75,000, even $100,000+ spine surgery is what we're trying to avoid or delay, which we're able to do sometimes. So yeah, and love to hear some follow-up questions on that if that is not clear. But each procedure is priced to the specific patient. We don't want to charge you any more or any less than is appropriate for that, to make sure that that we're able to get you everything you need. And it's all inclusive. We include anesthesia as well, and just a single fee. All right. So I have another question from Miss Linda here, and says that if I'm an older patient, do my stem cells still work at the same level, or do I need younger cells to make this work? Okay. So that is a question that we get pretty commonly. Okay. So think about this. If you suffer a cut, an injury of some kind, I have no doubt that every one of you that can hear my voice will heal from that. So if you go out and you have an abrasion, you slip and scratch your leg, or you get a paper cut and you're going to heal, any of that healing involves stem cells and involves an entire cascade of inflammatory response and healing, and the proteins that come from your platelets are engaged in that as well. And so if you're able to do that, that is living proof that your own body's proteins and your own body's platelets and stem cells are all functioning. Very commonly where this comes up on the age of the cells is when we're comparing that to amniotic or birth tissue products. And so that was one of the common sales pitches for using birth tissue, which we do not use here. And the challenge is that it's almost implied that the cells are alive when you get them from a birth tissue. And so the interesting thing about that, while they may actually be technically younger, they're not your cells and they're all dead. To date, we've had no tissue able to be cultured. We've not been able to culture any live stem cells from any of the birth tissue products that are on the market. And a lot of people don't know that. And you assume that this little bottle that they bring out, and sometimes it's even, we have representatives come here routinely trying to get us to use these products, and they'll freeze them and they'll do all kinds of things to make them seem as if they're alive. But I'm amazed. I'll give you one example. They took it out of the liquid nitrogen storage tank and said, here's the bottle of the birth tissue and the young stem cells. And I said, okay, well, how do I thaw that? Because it's thoroughly frozen. And can't make this stuff up. He literally said, oh, well, you just have the nurse put it under her arm and go like this. And I looked at him, I thought he was joking. And I said, are you serious? And he said, yeah. And I said, well, for how long? He said, oh, just until it gets to, thawed. And I said, well, how long is that? He didn't know. He just said, well, you keep looking at it and just put it back under there if it's not thawed. So very, very unscientific. And I ended the meeting at that point. So you'd be surprised what you see. But to answer the question more succinctly, your stem cells do work as long as you are living. And they have activity. And if you heal wounds, you have potential. For those that are really concerned about it, we have an advanced option that you can actually access at the Regenexx Cayman Clinic in the Cayman Islands. This is an unusual option. Not everybody wants to do that because you have to fly to the Caymans and have bone marrow extracted, and then we actually will bank that for you. And so we have a banking process that actually keeps that tissue available to you. So you can, let's say you're 35 years old and you fly out to the Caymans, you can actually have that tissue banked there. And then when you're 45 and you have a knee problem, you could go back and get those cells. Pretty expensive procedure, not something that I've done for myself, certainly. But for the majority of patients that we treat now, we actually don't need to do that. And we get fantastic outcomes using the bone marrow from your own body. Really, the oldest patient I've treated has been almost 90. We had a patient that was 89. We treated their spine, and he was thoroughly pleased with the outcome. So just to give you an idea. All right, so an anonymous attendee, let's see, we got a question. How long does it take to recover after the procedure? That varies with the procedure. I will tell you, some patients are shocked at how little recovery time. So we'll have patients come in for an intra-articular PRP injection, and they say, well, how long do I need to take off of work? Well, if it's a simple intra-articular PRP procedure, many times you can go back to work literally the next day. And so I've had patients that have treatments and mow the lawn that same weekend. So just to give you an idea. Now, for other procedures that are more in depth, I would say the ones that take a longer recovery time would be things like a bone marrow treatment where we want you to be non-weight bearing for a period of time to allow those cells to essentially adhere to the cartilage and really stay focused in that area for as long as possible. And so we'll have you in an area like that for non-weight bearing for about 3 days typically. Probably the longest recovery that we see is someone with a disc problem. So if you've got a disc that needs to be treated what we call intradiscally, which is relatively rare, say about 8 to 9 out of 10 patients won't even need an intradiscal treatment once we do a spine treatment. And not everybody's a good candidate for that. So it's a very specialized case. But in situations like that, I will typically have patients out of work for approximately a week, sometimes a week and a half, depending on what their level of inflammation was. So that's probably the longest, but very atypical. For 99% of our patients, you're back to baseline pain levels, pre-procedure pain levels in less than a week, many times in just a matter of a few days. So yeah, but when you, again, comparing that to surgical, I talked about a patient that I saw for shoulders earlier today, and we were talking about that if you had the traditional treatment for a shoulder rotator cuff repair, they would be in a sling for 6 weeks. Okay. And then after that would start therapy, and it would be months before they would achieve the maximum potential of that procedure. When our typical rotator cuff patients are back to work in a handful of days, are in a sling for typically 2 to 3 days, if at all. And by 6 weeks, I'm releasing them to full activity, and sometimes as little as 4 weeks, depending on how quickly they're healing and what the nature of the problem was. So yeah, really compared to almost any surgery, we are just literally weeks, if not months ahead in terms of how long it takes. So do amniotic stem cells work better? I think I answered that a little bit. We got into that. We do not use amniotic stem cells, and to date, there is no evidence that amniotic stem cells can be cultured, which means they're all dead in the bottle that you get them in. And if you've those of you that have any medical backgrounds, if you've ever been in the C-section room or labor delivery, you would really want to think twice about using that tissue because of how it's handled, and that has been an issue. There's been dozens of reported cases of infections and problems with amniotic tissue. There's just a lot of problems in processing that. And we have to date zero evidence for amniotic products actually achieving a better outcome. And so I'd love to go head to head with an amniotic. And I've had, I don't know how many patients had amniotic treatments and then ultimately found us. And, the most common thing I hear is not that they got an infection. It's that it just, didn't help either very much or at all. And their experience with us is most commonly quite a bit different than that. So we're so attention to detail. And many times the problem with amniotic, if a clinic is using that, very often they just use it in a way that's, and in some cases, just blind injections, which gets you back to some of the problems that we have with traditional medicine. And we just don't do that. So if it's not in the joint, even if it could help, if it's not in the joint, it's never going to get there, then we don't see the value there. All right. So do you do anything for neck pain? Is another question. Absolutely. We treat neck pain. That's something that's near and dear to my heart because I have a history from an injury, some whiplash and football injury from when I was younger. And we do treat commonly cervical facet pain, degenerative disease. And so with certain types of epidurals and ligament treatments in and around the cervical spine. So we absolutely do. And we actually have some unique equipment here that we're the only providers in central Oklahoma that even have that equipment. It's called digital motion X-ray, something new that we brought in when we built our new clinic here. It is totally unique and gives you a full digital moving video of the motion within your neck. And it can actually help you understand what the issues are, where the issues are, what levels. And that's something that we offer for our regenerative patients here in the clinic. So yeah, neck pain, right up our alley as well. How long would it take to make an appointment and how would I make one? So with that, very straightforward. I'm going to go to the next slide that you can actually see here, the phone number, and you can schedule your evaluation literally today because I happen to know someone who may be standing over there that could help you with that. So hopefully our phone doesn't completely blow up tonight, but rest assured that we will be checking those messages and we will return everyone's call within the next 24 hours. We'll be working on that because we've had a pretty high demand for the webinar, and this is more or less our inaugural webinar, and we've had really just a very warm and a response from people. And so we had really dozens and dozens of attendees register and log on. So we're excited about that. So so check us out on the website. And in terms of the time frame to get you on our schedule, we really strive when you call to get you in within the next week, even if that includes us having we'll add on time in our morning schedule, and we'll stay late in the evenings. And I want you to be prepared for really a session on educating you about your condition, understanding what's going on, and we want to gather all the medical data. So if you have images within the last few years that you've had done, we want all of that information, and we'd like to review that and go over that with you to get you the best possible answer about, first of all, what's going on, and two, then how can we help you avoid potential surgery. So, all right. So we're kind of getting to, let's see. So relative to I had a question about, would you get to see me personally? Everyone that can hear my voice, I will absolutely be the doctor that will be doing your evaluation. Now, I do have an outstanding team. Just to put that in perspective, we added up our clinical years of medical experience currently in our clinic, and it is over 200 years of clinical experience. So we have just a superb staff. I'm very lucky. I can't say that too loud because you know, they're going to all ask for evaluations and raises tomorrow, but just outstanding. We get compliments routinely with the quality of our staff, and I think a number of our patients can absolutely vouch for that. So so we really pride ourselves on that. But I will personally take charge of your care at Orthobiogen. That's one of the things that I've made time for, because one, it's very rewarding for me as a physician to bring this to Oklahoma, and I'm eager and excited to share the techniques and how this is able to improve people's lives. And I will tell you that for me personally, not just for patients that have had the benefit, it's been life-changing for me, and really has changed my outlook on what can be done for musculoskeletal healthcare, as I got very experienced in all of the other things that we do for traditional musculoskeletal problems. You know, it really opened a whole new world of possibilities and really good outcomes. So I'm excited to share that with you personally. And yes, I'll be the one in the room with you. And just so you know, typically I'll spend 30, 45 minutes, an hour and a half if need be, to go over your conditions. We make the time to do that because that's the most critical piece of the interaction. So, all right. So let's see here. All right. I had a question from Michelle. So she said, hey, I would like to thank you for the time you spent with her when she came in. That's awesome. Well, thank you, Michelle. I appreciate that. And so, and then also helping, she wanted to thank us for helping her understand kind of what's going on with her condition. And so we really do. And I tell patients, you don't have anything to lose by coming to talk with us, because I guarantee you, when you leave here, you will know far more about your condition and your diagnosis than you did when you came in the door. So just from that standpoint, and just catching up, and any of us, including me, you know, when we access healthcare, my family members do, it's very hard to navigate it. And a lot of times healthcare, modern healthcare, has not made time for us to help us understand what our options are, what we're facing, what to expect. And that part of medicine has really been left out. Really in the last decade or two, it's gotten a lot worse. And we are absolutely pushing against the grain on that to really change that, because I think that's a big piece of the quality of care that we're able to deliver, is really spend that time, that dedication to really help patients understand what they're facing, what the real options are. And I'll be the first to tell you, not everybody's a candidate. And it's important to understand that. But if you can just be confident, right, that you've explored the most advanced non-surgical options available, I think then that helps you as you head into that next phase of care that actually may be surgery. I don't want to scare you away from that, but I do want you to explore the options, and you're simply not going to get those in a traditional clinic. They just don't have the capacity. They haven't spent the time. They haven't taken the years it takes to become knowledgeable and aware of what else is out there, because they're kind of stuck in that rut of what the insurance company lets them do. And so that's what they do. So, all right. All right. So it's 7:55. So we're coming up on the end of it, and looks like I got through most of the questions. And so I really want to encourage you, if you have more questions, reach out to us. We are going to be doing this on a regular basis. And if you have topics that you want me to cover, such as shoulder, we talked about neck a little bit. I think it wasn't clear maybe that we do necks, and maybe that'll be one of our next topics about what can be done, for neck. So we'll put that on the calendar to try to help you understand about your individual condition. But more importantly, you don't have to wait for that webinar. You can actually come in, and we'll spend the time with you personally to help you understand specifically what's going on with your condition. And that's what I'm very interested in doing. And I'd like to do that for every one of you that would like to meet me. I'm happy to have you come in, and we'll go over things. So thank you again so much for taking out time of your busy evenings. And hopefully this was at least eye-opening to show you a few things, give you a little facts about, some facts about what is available, what's out there, and to share with you really our practice and what we do here. So I look forward to meeting each and every one of you. And for those of you that are already current patients, thank you for tuning in. And I look forward to seeing all of you. All right. So thanks and good night. So, all right.